Let's go live here. All right, hello. Goodness me. Technology, hey? Trying to figure it out. But sometimes I have some issues with it, as I'm sure we all do. Okay, so hello. So today I'm going to be talking about cancer rehabilitation physiotherapy. So you might not have heard of cancer rehabilitation physiotherapy before, and that's okay. A lot of people haven't, but we are just learning a lot about this in the industry at the moment, in the physiotherapy industry, and it's a fascinating and really valuable part of the field because it really helps people who are in a huge amount of need, I think. People who are going through potentially one of the hardest things in their life is going through cancer and going through the treatment and living with their cancer. So what we want to do is help people thrive whilst, through their cancer diagnosis or after their cancer diagnosis, and so they can actually feel like they are living more of their life as themselves rather than just being a cancer patient. There's so much more to life, obviously, than that. Although, obviously, that's the most important part, is to save their life. But at the same time, we want to help them have quality of life as well. So when it comes to cancer treatment, a lot of people feel quite disconnected from their bodies, and this is because so much of their treatment is about treating the cancer. And unfortunately, when the treatment stops, that also the support stops as well. So you can appreciate that that when they've finished their treatment, all of that support that they had actually stops. But the cancer rehabilitation physiotherapy doesn't stop. It's something that continues to go on even after they finish their treatment. And this is why it's such an important type of treatment for them. So basically what we want to do is help people to deal with all of the side effects that come from treatment as well, because there are quite a few different side effects. And a lot of people end up in pain, they have dysfunction, they're suffering with disability and dysfunction. And really, this is unnecessary. And a lot of the time, physical activity that is structured and it's specifically tailored to the individual is what that person needs to be able to feel better, feel well again, and start to actually live more of the life that they want. Now, when it comes to the treatment, it's quite varied because it does depend on where the person is in their treatment cycle as well. But I'll get to that in just a moment. So a lot of people, so I want to talk about why this is such a necessary type of treatment for people as one of the most significant factors for having side effects from having side effects and suffering as a result of the treatment is actually your health status before you go into having treatment. So if you have not fantastic health prior to going in for treatment, then you're going to potentially have more side effects and also suffering after the treatment as well, which it doesn't sound like. It's you've beat cancer, but the struggle to actually get through it would be much harsher on you mentally, emotionally, and physically as well. So some of the side effects of treatment, we've got obviously the short-term side effects, which are things that come as a result of either the operations or the chemo or the radiation therapy as well. So you've got quite a few different side effects there. Then you've also got your long-term side effects and also late effect side effects as well, which come on further down the track because, and I'm going to talk to you about those in just a moment. So if you don't get cancer rehabilitation from a physiotherapist or from someone that is qualified in the field as an allied health professional, then you're going to end up with a much higher risk of developing unnecessary disability or or suffering, poor health and deconditioning, chronic pain, chronic fatigue, muscle weakness, depression. You're potentially going to get a reduction in muscle mass and strength, a loss of cardiovascular fitness as well, decreased physical function, reduced range of motion of some of your joints, and also a depleted immune system. So it doesn't sound like much fun, does it? Like you're trying to beat cancer and also potentially going to suffer with all of these issues as well. Now, some of the longer term or those later effects as well, you actually have an increased risk. So you've beaten the cancer, but then later down the track, there's a higher risk of developing these other things. So cardiovascular disease, high blood pressure, diabetes, osteoporosis, and also a recurrence of cancer or a new cancer as well. Now, all of this can be reduced by physical activity. It sounds a bit like a magic pill, right? It sounds a bit too good to be true. But the research has shown over many years and many research papers that this is in fact the case. That if you have a structured and progressive integrated exercise program, physical activity program that is prescribed to you by a qualified practitioner, that you are going to get much better results and decrease your risk of all of these things further down the track as well. Because really with cancer rehabilitation, we focus on the person, not the disease. And that's the difference between all of the medical interventions, all of the medical treatments, which are completely necessary. It's that they have to focus on the disease. And the thing is, we get to focus on the person and helping you starting to feel like yourself again. So basically what we want to do is I want to just go through what it actually involves. So it's obviously to do with exercise. So doing some exercise, it's not all about exercise. There can be some manual therapy as well. And it does depend on where you are at in your treatment cycle as to what sort of treatment you are going to get. So exercise can help to preserve and even improve muscle mass and strength, cardiovascular fitness, physical function, range of motion of joints that are stiff and restricted, your immune system function. Even the chemotherapy completion rates as well can be improved on, and also body image, self-esteem, confidence, and mood. So again, pretty amazing just by doing some physical activity that you feel safe and that you can actually reduce all of these, potentially all of these symptoms. Now, some of the side effects that come as a result of the treatment, these can actually be reduced by the physiotherapy as well. So nausea, fatigue, pain, intensity of symptoms, duration of time in hospital, mental and emotional stress, and feelings of depression and anxiety as well. Now, I want to just let you know that I qualified in this area. So in what we call, there's a particular company that does this type of education for physiotherapists. It's called the Pink and Steel, and you can go and research them if you want online. PINC, Pink and Steel. So the Pink is the women's, is directed more towards women's cancers, and the Steel is more directed towards men's cancers. But you also cover the other cancers as well for that is not related to gender at all. And this type of therapy is obviously, it's, as I said, it's pretty new. It's not something that a lot of people even know about. Even the oncology departments don't even know that these types of services exist. And I became really interested in this because I think that it's an area that I'm really passionate about, because I get to look at it from a very holistic point of view, and because cancer and the treatment can really meld well together, the physiotherapy treatment, and it has this more holistic approach. So you can see the mental, the physical, the emotional impact that cancer and also the treatment has on people. And really, that's right up my alley. I love helping people with all those different areas, not just helping to treat a physical injury. And so, if you haven't met me before, I just thought I'd do a bit of an intro. I didn't actually introduce myself at the start. So I'm Jen Edge. I'm a physiotherapist, and I have been for 16 years now. And I just find that this type of this type of physiotherapy is such a valuable service for people who are going through such a hard time in their life. And I'm really passionate about helping people who are going through those sorts of situations. So I've just finished the steel course as well earlier in the year, and I'm really looking forward to working with more and more people who are going through either pre-treatment for their cancer, or they're going through their treatment, or they've finished their treatment. They just want to start getting back to living their lives. So, because really what we want to do is we want to help people and arm them with these learning skills for life. Okay, so it's not just come and learn these skills and then they're not applicable to the rest of your life. That's the great thing about these skills, is that you can use them for the rest of your life. So also I can appreciate that the impact of cancer, it's not just on the physical body, it's not just on you, and it has very much a far-reaching impact on family relationships, finances, your ability to work, your energy levels, your relationships of all kinds. And so it's just this idea of helping people to achieve whatever it is that they want to achieve. It's not about what I think they need to achieve. It's about what they want to achieve. And so it's really understanding what that is, what's important to them, and then being able to address those things and help them to achieve that through the treatment and supporting them along that journey. So one of the things that I've noticed as well is that because a lot of the time you can't see when someone's been through cancer, like if they've had surgery or something like that, and they've come out the other side and they've finished all of their treatment, they're still left with obviously physical scars, but also emotional scarring. So this internal scars as well. And something that I think is really it goes unnoticed. Like you don't see it from the outside, but we don't realize what people are struggling with underneath. So that's something that we can help to address as well, particularly the physical symptoms when it comes specifically to physiotherapy. Is we don't know that they've got tightness, or they've got pins and needles, or say they've had a breast cancer surgery, and they end up with all of these symptoms potentially down their arm, or things that you can't even see because they've got their clothes on, and you can't see that they're suffering with these consistent and constant pains and discomforts. And so it's really being able to help these people with those things as well, and helping them to cope with those things. And fatigue is a really big part of not just when they're going through the cancer treatment, but also after, because you can appreciate if you're going through your treatment and you don't do any exercise or any physical activity at all whilst you're doing that, that could be months of not doing anything. And you're going to become very, very deconditioned and very unfit and weak. And so trying to get back into something is much harder than if you just keep doing a little bit each day or every other day, and so that you're not going to become so deconditioned that, yes, you may have come out of your cancer and gone into remission, but then you're just feeling fatigued and you're just completely, it's just suffering with this unnecessary disability. So that's really important, to be able to help people to avoid that disability by staying active and feeling safe to do that. Going to someone that is qualified and certified in this area is so important, because I didn't know before I went and studied these courses. My goodness, I found out so much that I didn't know by doing these courses. And so really amazing information that was delivered to us in the course that I can now pass on to my patients as well. So it's really about 4 phases. There's 4 phases in the cancer rehabilitation journey when it comes to physiotherapy. So there's the pre-surgery, so pre-op stage, which is all about helping someone to prepare physically for their operation, get them as healthy and as fit as possible prior to their op. And then post-op is more about, okay, how do we help them after they've had their operation? How do we get them moving in a safe way so that they feel like, okay, I can still do something and keep active? And then the third phase is during their cancer treatment. So this is during, say, their radiation or their chemotherapy, or maybe they're getting some sort of hormone therapy or something like that. So it's while they're going through that, you're helping them to deal with the side effects, but still, again, staying active. And the good thing is, as I said, that probably my top three things, my top three benefits, the best things about doing this type of work and helping people through this is that it can reduce the side effects from the chemotherapy and radiation. It can actually improve the effectiveness of the chemo and radiation as well. And then it can reduce these long-term potential side effects, which a lot of people are struggling with further down the track. So years down the track, they end up with cardiovascular disease, osteoporosis, diabetes, and it's just not something that it doesn't have to happen. It's something that you can reduce the risk just by being able to get some sort of activity in there. And then lastly is that long-term lifestyle fitness, what they call a fitness survivorship phase. So it's appreciating that, we want to be able to set you up for life, to be able to stay physically active and be able to address any ongoing issues. So what are the things that we do? We do an assessment, lots of questions, and we do a functional assessment as well. We test your movements and your strength and all those things to see where you're at and get a good baseline. We have a look at your scars to make sure that there's no issues with your scarring, and just keep an eye on those as we go as well. We strengthen, if needed, strengthen core muscles, improve posture, improve your range of motion of any particular joints that may be affected. In particular, women, depending on what sort of breast surgery they've had, they can end up with shoulder issues, and that can become a real problem. So restriction in their shoulder and pain. Or you may have postural issues because you're trying to protect yourself from feeling pain or pulling on your scars or those sorts of things. So we really try and address those issues as well with that. We also do things to try and improve your energy levels. And breathing can be affected as well, so making sure that we help to improve that too. Reclaiming body confidence and control, and also shifting this focus from illness to wellness and helping people to feel well again and feel better. How do we do this? We do this with manual physiotherapy, we do it with joint mobilizations, pelvic floor exercises, strength and conditioning training that is tailored to the individual. Breathing techniques and education, core strength exercises or Pilates, fatigue management, also functional life skills as well. So goal setting, anxiety relieving strategies, energy and sleep optimization even, because you can appreciate that pain can interrupt your sleep cycle as well. So really our goal is to get people back to doing whatever it is they want to do, back to living their life. Because that's pretty much what anyone wants, right? They just want to be able to get back to doing what they love. And that could be anything. That could be, not that you can do that so much right now, but that may be traveling, that may be spending time with family, being able to pick up your children or hang out the washing. Not that, I don't know, many people that like doing their washing, but you want to be able to do those everyday tasks and just be able to do them with minimal discomfort or no pain ideally. So there's lots of questions that are going to come up potentially for you around this area, and I would encourage you to seek out a physiotherapist that is certified in this area, in this cancer rehabilitation in your area. And we do offer telehealth or online video consultations as well for cancer patients, because obviously you may have a compromised immune system at the moment. So that's a really great service that we can that we can provide you with too. And so because you're going to probably have lots of questions like, what's the right exercise for me? What time should I exercise? How much exercise I should do? What sort of exercise is safe for me after my surgery? Lots of questions are going to come up, and obviously, the best thing you can do is just contact your closest physiotherapist that is qualified in this area. You can go onto the Pink and Steel website, and there are all of the Pink and Steel physiotherapists are registered on there, including myself. I'm located in Dubbo, but you can call me from anywhere. So if you do want to get in contact, just head to my Facebook page, which is at Physio Wellness Clinic, or my Instagram, which is also at Physio Wellness Clinic, or you can call the clinic on 02 6885 1696, and you can ask to speak to me, and we can have a chat and see where you're at and if it's something that you think that you would benefit from. So basically that's pretty much it from me. I do hope that you found this helpful and valuable, and that if it's not for you, you pass it on to someone else, and just have a chat. It's been a little while since I've done a live video, so it's not quite as probably as good as I've done in the past, but hey, got to get back into it, get the message out there, and hopefully that was of some value to you. So if you did enjoy it, please like and comment and share, and I hope to see you again at some point soon. Look after yourselves, and I'll talk to you soon. Bye for now.